Hi everyone, this is a kind of a special update for my channel. I was debating whether or not to do this, but I keep seeing stupid things, and so I felt like I needed to say something about the coronavirus that's going around, the pandemic, and the way people are not taking it very seriously. And what kind of prompted this was seeing the protesters who are out on the streets for some reason wanting to spread the virus. I don't understand their point. They want to go out and be able to go to the salon. I want my hair cut. So not only do they want a haircut, but they want the person getting their haircut to be out in public as well. I just got responded to on Facebook by someone who basically claims that we should all be able to go out as long as we're wearing masks. No, this is a pandemic. That means something. That's very serious. And it's a novel virus. It means that your immune system has not seen it before. So whereas your immune system has seen flus and colds and things before, and you may come down with those, your immune system hopefully will be able to handle it eventually. But this is new and a lot deadlier than the flu. I was just looking up the stats on the World Health Organization site. But currently, we're not sure of the death rate for coronavirus. It's too new, but it looks like it's currently around 3 to 4%, whereas the death rate from the flu is like 0.1%, which, if those are accurate numbers, would make the coronavirus at least as 30 times as deadly as the flu, if not more. Also, I didn't break it down by age, but I know you can find some websites where it's broken down by age, so it may not be 3 to 4% if you're under 15 or 18 or 20 or something, and maybe over 3 to 4% if you're over 50. So it averages out to be 3 to 4%, but ultimately, if you're a little older, if you're immunocompromised, if you have some underlying health condition, you're in more danger. So the responsible thing is to not endanger people. I'm not sure why this seems so hard to get across to people. But not going outside helps a lot. The virus is still spreading, it still will spread, but hopefully by slowing it down enough, we will give enough people enough time to develop some treatments, maybe a vaccine, but something that might be able to help. Also may keep people out of the hospitals longer, so we're not slamming the hospitals next week with 100,000 people, but maybe only a few thousand people per week, and that those medical supplies and those people who are handling all that, the doctors, the nurses, everybody who cleans the hospital and staffs the hospital, are not overwhelmed and are able to cope and hopefully don't come down with it themselves. I don't know what you think you're going to do if you go to the ER and the doctors and nurses are all dead of this disease. I mean, then what, right? So I thought I'd just make this little video with some things on the things you should do and hopefully that you are doing. Please not only think of yourself, but of others, the people also in your household, the people at the grocery store, the workers at the grocery store, the people, if you were to go to the hospital, the doctors, the nurses, the staff there, and everybody else, the people who live in the houses with the people at the grocery store. I mean, what if you infect the person bagging your groceries and they go home and infect their grandmother? Maybe they never develop symptoms, but their grandmother dies. You don't know. Apparently this is really easy to pass along before you show any symptoms. So all these people who are saying, hey, if I feel healthy, I should be able to go out without being tested. We don't know that you are healthy. You just feel healthy, but you could still be contagious. That's the problem when there's no testing. So we don't know. Other countries that are doing more testing are going to know more things more quickly than here in the United States, where we're not really testing many people. And they'll be able to get a handle on it, and we won't, because we won't have the data. And you have to have data before you can make good decisions. So I am thinking that the rest of the world may recover from this and go on, and the United States will still be wallowing in tens of thousands of cases a day or a month or whatever it's going to be. So let's look at some of the things that you can do to try to keep from getting this yourself or from spreading to others, even if you don't feel like you have it. Some of the things we're supposed to be doing is social distancing, staying 6 feet apart. I did see an article when Florida reopened their beaches. It says that some studies are looking at this may be able to spread over 30 feet, so 6 feet is no good. But again, we don't have really great data yet, so I don't know. Play it safe. Don't be around other people at all. That'll help. You should be obviously washing your hands a lot. We spread a lot of diseases on our hands, and washing hands isn't something a lot of people do for some reason, and that includes healthcare workers. I used to work in a hospital. This was over 20 years ago, but even then, they would do studies where they would put a water-soluble dye on the nurse's hands, and then come back the next day with like a black light, which is when you could see this dye, and find handprints everywhere. And all it would have taken to have no handprints in the hospital would have been for those staff people to have washed their hands, and clearly they didn't. And that's people who work in the hospital who should know better. But we should all know better by now. So wash your hands a lot. With soap, you may want to use a hand sanitizer. I'm not sure I've seen anything that says they're really effective. They may help you remember more to wash your hands. I don't know. But certainly soap and water, if nothing else. Don't touch your face, right? So we're always doing this, and you don't know how often you do it until you start trying not to do it, right? So we're asked to wear masks in public. That may or may not help. No one's really sure. But one thing it may do is remind you not to touch your face, because when you move your hand towards your face, the mask is there, you may be like, oh yeah, don't touch my face. So even if it only helps you to not do that, it is a little bit helpful. So remember, we need to do this for each other. So, follow the guidelines, stay safe, and I hope you're enjoying this channel if it's somewhere you come very often. And just please take care of yourself and others, and think about all the people that you could be helping by sitting at home. So I'll see you later. Bye-bye.